We want to thank you guys for joining us. My name is Mark Hammond. I'm the president here at Pediatric Home Service. The purpose of tonight's meeting is to prepare us and you guys for the upcoming legislative session that's going to be starting here in a few months. And we want to get you guys kind of up to what the current nursing crisis is, which many of you guys are understanding and facing, whether it's with our agency or with another agency. And what we want to do is get you guys to see the challenges that we're facing, all the agencies are facing, and what you guys can do to kind of help us with the recruiting and the retention of nurses. Together, we will make a difference in this. We need your guys' assistance to help us get the word out and to spread the word out to all of our representatives and legislators. And we're going to kind of walk through some of that stuff tonight. So I'm not going to be speaking the entire time. Thank God for that. But I'm going to introduce a few folks that are here. Carletta Crawford, who's in the middle over there. She's our newest director of nursing. Carletta's been with us for 9 years at PHS. She's been in the infusion business or in our infusion division for 9 years. Just recently 5 months into our home care nursing division. We've got Bill Amberg, who is our PHS lobbyist. Bill's been with us full-time 2 years. He also worked with us through an association as a lobbyist for about 3 years. So Bill's very familiar with us and some of the things that we're doing on the legislative front. Susan Wingert, she's the owner of this organization, PHS. She's also better known to me as my mom. And then we also have Representative Matt Dean. He's the chair to the Health and Human Services Committee. And I'm just going to give a little information on Representative Dean. He was first elected in 2004. He's currently serving in his 6th term in the Minnesota House of Representatives, representing Delwood, White Bear Lake in the North Oaks area. Representative Dean is chair of the House and Health and Human Services Finance Committee. He also serves on the Health and Human Services Reform Committee and the Ways and Means Committee. Lots of committees there, Representative. He served as a majority leader of the Minnesota House of Representatives from 2011 to 2013. And then also Representative Dean is an architect. Lives in White Bear Lake, I believe. White Bear Lake. Has 3 children, a wife who's an OB/GYN, so he has a little bit of a healthcare background. So with that being said, Carletta, I'm going to have you come on up, and she's going to give a little insight.
Okay, welcome, welcome. Thank you everybody for coming. We know, not as well as you know, that it's probably been a challenge for you all to get here, changing schedules and getting rides for kids and rearranging lots of things. So thank you all for being here. So I'm going to be preaching to the choir tonight, a lot of what I'm going to be telling you. We want Representative Dean to really understand some of the challenges we face and what this nursing shortage really means. So if I'm telling you some things that you already know, we're telling our story here. So please join me when comes time for that, and we'll get our word out. So let's talk about home care nursing at PHS. And really across the home care agency conundrum here. Hiring and retention of nurses has been a challenge for PHS, but it's not representative, or it is representative of the entire industry. So those of you that aren't here with PHS, you probably have a similar story to our clients with PHS. So when we have nurses that leave us, we make an effort to have them do exit surveys to help us understand why they're leaving us. The most frequent reason that we hear nurses are leaving is, you guys probably have heard this before too, the better pay at the hospital. And because reimbursement is different, they get paid different at the hospital, they can pay better at the hospital. In my opinion, turnover in nurses cause really 3 major problems here. The first one, again, you guys know this, disruption for patients and families. So the soft costs of that are disruption in your home, stress of the transition, and then the time it takes for your family and your children to get comfortable with these new people that you are supposed to leave your children in their care. Yes, Tana, hi. I was telling Tana she really is a celebrity here. We go back. I used to work in the infusion department and have worked with Jill, so just a sidebar there. All right. So obviously, yes, and I'm sure that you all could tell your story about the disruption that turnover causes and new nurses cause in your home. Administrative expenses. So what that includes is retention, recruiting, interviewing, and onboarding. So these are all parts of our business that we really can't bill anybody for. So that's the more turnover, the more expense with that. And then training expense. We pride ourselves at PHS on training. We make sure that families are comfortable with their nurses in the home. We make sure that nurses are comfortable being out independently in the homes. So we have that as a major priority, and that is another expense that is not reimbursed currently by any payer sources. So a few numbers here. Not real pretty. We lost more nurses than we hired in 2015. So this is PHS specifically. In 2014, we hired 145 and lost 99 with a net of 46. And this year, year to date, we are sitting 79 hired and 99 lost. So healthcare costs are already an issue, and this added turnover, turnover adds to that cost, obviously. So as we move into beyond PHS and pediatrics, this is a greater Minnesota problem, not just PHS, not peds, but across the state. So just some numbers here. You can see up at the top, registered nurses, we're looking at new jobs and replacement jobs. It's way up high on the list out of the medical health occupations. And this is a projection that was made back before 2010, so between 2010 and 2020. So in 2020, healthcare will be the area of most needed workers, and RNs top that list. And even moving out broader, the whole country is seeing this. And after talking to Judy, I don't have a lot of reference, but even beyond the country is seeing this. But this slide is taking a look at registered nurses and direct care workers combined. They're going to account for 8.5 million jobs by 2020. So that's a really, really huge number. Without changing how we're going, kind of back to that slide referring to that, without changing how we're going now or coming up with real new innovative solutions, the need is not going to change. In fact, it's actually going to increase. And without those people to fill in, we're obviously going to be even worse than a shortage. So why are we seeing this trend in nursing for RNs and for home care workers? Well, I hear it probably every day, the aging US population, which is fantastic. People are living longer, but they're also using medications, treatments, those kinds of things to live longer and to live more productively. And then surviving pediatric population. Again, I'm speaking to people that know this best. You guys know, without the things that we can provide you and the medications that have been made for your children, they would not be living the productive lives that they have been. So then we get to healthcare consumerism. So how many people have made a review of a restaurant online? Anybody? Yes. Did you guys know that you can actually go on and not only make a review of a provider or a home care agency or a hospital, but pick out? You can go pick based on other people's reviews. I was a little surprised when I Googled my name and my name came up and you could leave a review for me. There weren't any, but that would be a really exceptional way to really be my friend. No, just kidding. So I guess the point being, people can pick where they want to go, what they want to do, where they want to use it, despite prices. It's just right at their fingertips now. And then the epidemic of chronic pediatric diseases. And that kind of ties into the technological advances. As we see technology improving with telemed, telehealth, electronic health records, it's just getting easier and easier to take really good care of kids at home instead of in the hospital. And also get kids out of the hospital and save their lives. And so we're seeing that these kids really are living and thriving when in the past, not to sound grave, but a lot of them would have not made it home. And so we're so happy to be able to take them home. But again, that adds to the shortage. We have this supply and demand thing going on. So again, refers to the rapidly escalating healthcare costs that I've mentioned. So the reason we're here tonight, what can we do about this? That's the $1 million question, right? What PHS is doing is we feel that we really offer competitive benefits and salaries to really attract and retain those nurses. We offer, again, like I talked about, extensive nurse training. We have a really active education department that Jill is a part of, actually, in our infusion department, but we we put a lot of time, money, and commitment into educating, and not only our nurses, but our families too, to really make you guys the experts with your children. We're very active in legislative efforts. We just had an offsite meeting this week to really brainstorm and come up with some really, even if they're outstanding, crazy ideas, just to get some ideas flowing. What can we do? What are we going to do about this? What kind of structure can we look at? Who can we go to make some changes? And then just in the last couple of days, we were invited to testify at the Capitol about the HCN staffing crisis. So we're really excited about that, and we feel that will be a great opportunity for us to really tell our story. And then the last thing I'd like to leave you with is, actually, back up one thing. Members of the Home Care Association. So what that is all the home care agencies have the option of belonging to a home care agency, and it's great for networking. It's great for strength in numbers and really bonding together, getting references, referrals to really speak to the problem. So the fun thing. So today I woke up this morning and I was kind of thinking back about a speech giving lecture that we had, and I wanted to do something fun. So I thought, I'm going to do a survey and find out how many nurses in nursing school actually had a clinical that involved home care nursing. And I didn't go to just the new nurses because I thought, oh, home care's got to be getting out there. They have to have had that. I went to nurses that have been a nurse for 30, 40 years and nurses that were brand new, that we just hired today, that just recently graduated. So I asked 20 people. Does anyone want to make a guess at how many people actually had home care clinicals? It was 2. Yes, and the surprising thing, again, is our new hire that just finished school had no home care experience exposure at all. So my point for telling you this is we really have gotten involved with the skills of nursing. We really feel that we need to get in there to have people hear us, to listen to us, to see what home care is. On a personal note, my nursing, and I was involved in the numbers, the 20, I was not one of them that had a home care clinical. My home care clinical was an older gentleman that needed his pillbox filled. And so we went in and filled his pillbox, and the rest of our visit, which was the majority of the visit, was spent playing cards, and off we went. That was it. So we're going out to the nursing schools. We're trying to get our curriculum in. We're going to the school nurse or the nurses association. So those nurses that are just starting out that really are wide-eyed and just soaking everything in about nursing. So we're hitting a lot of different options to try to really be heard about this issue going on. And then finally, for us personally, we've had no new home care patients since last November that we have taken on. Any questions for me? Yes.
They had contacted me a couple weeks ago and asked if they could send students from Rasmussen out to my house. We have 4 kids that are home care, 3 traits and different. And I said yes. 4 days a week we have students come out and come in our home.
And that's a really good point, and thank you for reminding me. We have contracts with several of the nursing schools to actually come and do shifts. So what they do is they come into PHS and they take a respiratory class with Bruce, our respiratory or education manager. So they really get what the new nurses get for education, and then they come in and kind of depending on how the complexity of the patient and how comfortable they feel, they'll actually take care of the child with the assistance of the nurse. So we're working on that, and actually they're having trouble finding pediatric clinical sites, so we're getting more requests for that. And so if I can just put a plug out, if you have contacts, I know that this is another person in your home, but if you're willing, that's another venue for us to be able to really get these new nurses interested in home care too.
I think that's a great point, real quick, to be able to offer that insight to what it is to be a home care nurse. The more opportunity we can have these young nurses come in and see what goes on into a home helps all of our cases to be able to give them that opportunity. If we don't give them that opportunity, there may be another nurse or two or three that don't even consider home care as an option. So.
You know, one other thing I just want to mention, when we talk about it here, we talk about the need for home care nurses, and it's an extraordinary need, and we want to make sure you understand that's our focus. But there's one more thing that we need to talk about when we talk about nurses, and that is the fact that there's a shortage period. And there are a couple reasons for that I think are pretty telling. The first is there's not enough people who want to educate nurses. So the nursing educators are getting smaller and smaller from their numbers, which means unless we do something to inspire people to do that, the shortage we see today is ongoing. The second thing that has happened is in the past, we had, well, back in my day, we had 3 levels of nursing schools. We had 2 years, 3 years, and 4 years. 3 years are gone, 2 years are leaving, and now, instead of being able to recruit every 2 years from nursing schools, we have every 4. So we have less numbers being educated, and we have them in the schools for longer periods of time. So when we talk about the significant need for nurses today, understand in home care, it doesn't pay as much. And well, let's face it, there are 3 things nurses really like. They like a very secure environment that they can move in. They like colleagues that they can talk to and say, here's a question, what do you think, and a problem-solving scenario. And they like to get paid well, and what does home care do for them? Well, none of that. And so what we've got is this place that we need to recruit to, but we have ever-dwindling numbers. So when Carlotta talks about that off-site that we went to, and one of the reasons we've asked Representative Dean to come here is to tell us how we can work with the legislature to begin to look at perhaps a different model. And when we are looking at different models, you can only imagine that we've looked at a lot of scenarios, many of which have absolutely no reimbursement available to it. So when we talk to Representative Dean and when he talks to us, one of the things that I'm hoping he will be able to help us with is to recognize that when he is in the legislature, we have hundreds of competitors for his time. We have hundreds of competitors for the amount of money that he has to spend to provide services. We're hoping that we can learn from him, how do we make ourselves more important to the legislature than anything else. Over the years, I have been told that I probably can't continue to use this phrase, but I'm going to for just the lack of another one. Back a couple of years ago, the marijuana clearance is what I call them. I know I didn't find a new name. Whether you agreed with what they were doing, whether the bill that came out was anything like what you thought it should be, the only point I'm trying to make about those parents is there was about 8 of them, and they never gave up. And they faced the legislature that didn't want to do anything. They faced a governor that said it's not going to happen. They faced the police that said this is a bad idea, and they got something. So when we talk to you, we want you to know that you are going to be the reason we succeed, not us. But you. And for that reason, we thank you for coming, and we thank you for allowing Representative Dean to share some of what your experiences so he understands what we're facing and how he can help us get that.
Thank you. I thought I saw a question in the back. No?
Why have you taken no new home care patients since November?
I think that we would all agree. Our reasoning is we want to staff who we have. And
we want to make sure that we can continue to commit to the families that we already have in service.
There were families you're turning away.
Mm-hmm.
I think we on average turn away about 20 to 30 families
A week. It was more. We have now gotten the hospitals to just know that they have stopped calling, and they'll occasionally check in just to say, hey, are you taking patients yet?
It's a great question. I mean, it's something that we hear from our nursing staff. You know, we love taking these new babies home. We hear from the hospitals, come on, we need providers to be able to take them home. There's not many providers out there that are willing to do it. Or if they are, they may not be committing to what the kid needs. But again, the reason why we're not taking them home is because we want to continue to try to fulfill our commitment with you guys, the families that we have on our service. And if I took a baby home now or tomorrow or the next day or whatever, we may have to be Robin, Peter to pay Paul. We might have to pull nurses from your home, put them into another home, and that's something that it's very challenging to do. But there is that pressure from our staff that want to continue to be in a new home environment, to see new patients, and that sort of thing, to be able to appease some of the hospital folks so that they can continue to get these kids out. I think remember when you guys were in the hospital, how much you wanted to get out, and if there's no providers out there willing to take them, there's a huge problem there. Hence why we want your guys' help.
And I think
I think Mr. Anderson would like to ask a question.
No, I don't. No. I'm just going to ask how many nurses work for PHS.
150 right now.
Okay.
It's an ever-changing number.
It's very fluid.
Yeah, so these numbers are really big when you think.
Mm-hmm.
Yeah.
Yep.
I think it's important that you realize that when we look at a team, PHS is a team, which we will then work for prescribers to support, and then our competitors, our colleagues to work with us at. The model we're looking at will be different than what you've seen. And there are two reasons for that. Number one, these numbers of nurses are going to get less. You're not going to get it back. That's a fact. We don't like it. We don't want to admit it. But that's a fact. So that leaves you in a hole. That leaves you without help. And so to get you help, we have to look at something different. And that's not going to be an easy for all of you to do as well. It's going to be tough. And we're going to have to be creative, and we're going to have to look at families to give us some feedback on how we can utilize this very scarce resource to take care of your children. But we got it backed up in the hospital now. We have a baby that might be access to lie that can't get out, that they're big enough.
So I have a question for the legislature or representative. From a financial perspective, if they're backed up in the hospital, it feels like it's a pretty obvious decision that you have to find some mechanism, just purely financially speaking, forget about the fact that it's better for the families who want their kids at home and will thrive better at home.
Mm-hmm.
Even if you took that away, purely from a financial perspective, what's the discussion look like in that committee or the committees like it around healthcare costs? Because that seems like a no-brainer.
In fairness to Representative Dean, I want to be clear on something. This crisis is fairly new to them as legislators. We have just begun to introduce this concept. So
Yeah, and my goal is not to attack. My goal is simply to ask the question. It's not a question. It's not an issue that's snuck up on us that we've right? I mean, each passing year, the dollars in the calculator's been running, and presumably in a finite resource space, we should be trying to be more thoughtful about that. And looking at it from a financial perspective. So presumably there have been discussions on some level, whether we do with others. What's the current thought process of the legislature in terms of ensuring that those dollars are being utilized in the most effective way possible?
Well, I think that it's important to understand that common sense doesn't always rule how stuff works. So there are many instances where not just in home and community-based services versus in-hospital services, it's a common thing, but it's not specific to that. It's psychiatric beds versus community beds. It's treatment or pre-treatment versus acute treatment, chronic versus acute. So there's many of those circumstances where you don't do what makes common sense. But in this case, a lot of that has to do with capacity and the economics of beds and the availability of people in the community, particularly in greater Minnesota.
One of the things that we have struggled a little bit with, and it's unfortunately nothing the legislature has been able to conquer, and that is the cost of what we're asking for, but something that we call a dynamic fiscal note, which basically says if there's cost here, is there savings there? And somehow the office of the budget, whatever they call that group now, I can't remember, has a struggle to be able to say, if we spend money here, can we prove it's the reason that we've saved money over there? And so it's hard to say, okay, if we can put this money over here and we say it's cost savings, do we really have the ability to prove that that cost savings came from this action? And so it all looks like a cost when you look at it.
I know there's going to be, Patty, you have one other.
Well, just a thought around that is in what you guys do, I mean, you're the best in this. There's no doubt in my mind. You've seen and the training and the nurses, the caliber of nurses that we get from you is better than anything. Better than some that I've even met in a hospital. But what I think, and you guys addressed it, is bringing nurses to your home. Students is what PHS has done for us. But doctors don't get it. Mm-hmm. Doctors don't know. So the U of M and PACER, with the parents as teachers in that program, those residents come to my home and they're blown away because they had no idea. And it's the voice that even, and I don't mean this bad because I'm pretty old, but even the older guys that are part of our team, doctors, I have an invitation. I finally just got sick of saying it, so I wrote it. Come and see what it's like in my home so you can see. We had legislators come and I had cost tickets on stuff so I could show them. Look, I saved $150 a week on this because I make my own sterile water. But to show them and let them see, there's tons of cost savings by letting us come home. But more people need to see it because it's not in their frame of reference.
I think we've got a lot of great questions. I'm going to have Bill come up and say a few things, and you guys will be hopefully time for questions. There will be. I mean, we'll say anything if you guys want to. I don't expect anybody to say questions.
Great. So I'm just going to talk really briefly about what we've been doing. I think Mark referenced before about 3 years ago, he and Susan asked me to come in-house to work full-time on these issues. So we've been working on home care nursing for several years at the legislature, and I'm sure Representative Dean can support this. Legislation does not happen quickly. It's a democracy. Every member of the legislature has one vote. They're elected by the people in their district. You don't get overnight solutions, but that's how we make our laws and we change our policies. So that's the commitment that PHS has made to put a whole government relations program together, which makes us really, really unique amongst nursing agencies and home care providers in general. But we do belong to the Minnesota Home Care Association. We've belonged to the Professional Home Care Coalition. We belong to the Durable Medical Equipment and Supply Trade Association in the state. So we're very engaged in the public policy making process. And we've had a bill, House File 1122, in the House that we actually made it through all the relevant committees with help from many people in the room. I see Pat and Debbie and the Werglers, and we made it through all the relevant committees in the Senate. But as Susan was just and Mark talking about, it does cost money, and that's always a struggle. So we're we're working right now to say, this is a really big problem. There's obviously something wrong with the model. The finances are off. And we're continuing to work on that with our legislators that are working with us on the legislation. So in the interest of time, I think I will ask Representative Dean to come up here and talk to you folks a little bit about how easy it is to engage your actual legislators in your district.
Thanks, Bill. My name is Matt Dean, and I represent the area of White Bear Lake, kind of northeast metro, and I see I was supposed to be done at 6:50. I've already gone over. I apologize for that. So, these doggone politicians, they always talk too much. So, we have a really good relationship at the Capitol with folks with complex medical needs. I'm very proud of the work that our legislature and legislators have done to try to engage within that. And I just want to share with you a couple of thoughts and maybe some take-home points about how you might want to deal with your legislator so that you can have a personal impact at the Capitol in the legislature, and just how that works like in real terms for people. We have just passed a budget in the last year that'll go for the next 2 years. We spent about $13 billion in health and human services, and much of that money goes to lots of complicated things and insurance agencies and lots of things we all wrestle with. But the biggest cost is one person taking care of another person. Whether it is with Alzheimer's, which is an incredibly growing, expensive thing in the state of Minnesota, whether it's $217 billion nationally. In Minnesota, if you take everything in the country and divide by 50, we're right in the middle. So if you think about that in terms of how much just that one disease is going to be costing Minnesota in the next year, that doesn't include donated time, which you understand just how much of an effort that is really in terms of our budget. So just overall trends, I can tell you that people are living longer. People with complex medical needs are living longer within that. That's all good things. We are also dealing with limited budgets and escalating costs within healthcare. Also, another trend is moving from hospital-based care to home and community-based care, which is a good thing, which is what we want to have happen. We're also having limited resources, so those two things are kind of going like this. So we want to have people living in the communities, receiving care in the communities as close to home as possible, but the reimbursement for that is less. So that's a problem, right? Those two things are not into sync. So there's a couple of things that we're doing to address that. And Bill and others are really sort of bringing that to the forefront for legislators at the Capitol. Now, there's an interesting fact about legislators that they're pretty normal. Okay, so Bill said, just try to get across the idea that it's not super intimidating to go talk to a legislator, and I don't consider myself very intimidating, so it's not. It's a lot easier than you think. Everybody's got two legislators. There's 67 senators and 134 members of the House. You all have two. So you have one House member and one senator. Every senator has two House members. And together the House members do all the work of the senator because they're very, they have long white wigs and flowing robes. They don't really do anything, so we do most of the work for them. That's just a joke. But you have two. And so that you can contact your legislator. If you're a constituent and you contact your legislator, the easiest way to do that is by email. You can write you can write a letter, you can write an email, you can make a telephone call, you can meet personally, all of those things. And whatever is easiest for you. If somebody calls me, I will try to call them back. If somebody writes me, I'll try to write them back, and if somebody emails me, I'll try to email them back. So I do it kind of in however they communicated with me. Other people do it differently. But the point is that that's our number one job as a legislator is constituent services, and we always get busy and we get stacked up. And well, I was waiting today, had responded to a letter, a woman had written me a letter, and I had written her a quick note back, and she had emailed me and said that she hadn't heard back from me yet. So then I just emailed, said I sent out the letter, it's on its way. So that's what should happen. A lot of times things get caught in the mail that we get lots and lots of email, just like you do at home. And sometimes you get emails from all over the state. And I will answer email from outside of my district, but if I have time. But if I don't, I won't. I won't respond because my district is there. If I can respond to something outside of that, I definitely will, and I often do. But priorities are for our own constituents. And so oftentimes what I will do is I will forward something to, if somebody from Brainerd calls me about a healthcare issue, I will forward it to their legislator and then maybe give them a call or an email just saying that this is your constituent with this problem. We should probably address that. So that's kind of how we tend to deal with things. The communications that we get from constituents are, very, very important to us. And so if you identify yourself as a constituent, that's a big deal because we all will respond to constituents. If I'm in a committee hearing and one of my constituents comes to the Capitol, I will go out of the committee hearing to meet with a constituent. No, Bill's a lobbyist. I love lobbyists, but we don't leave committees to meet with lobbyists. So, and generally speaking, if you ask for a meeting with your legislator, usually look for 15 minutes. So you schedule 15 minutes to kind of get in and out quickly and to communicate what your issues are, and then if necessary to follow up. So a trick, if you want to kind of connect with your legislator, the easy thing to do is in the subject line of your email, if you put, let's say I'm writing to my Senator Chamberlain, I will put, "Hi from Matt Dean, constituent," in large capital letters, 55110, which is my zip code. So that, if the legislator is looking through his email on his phone typically, it'll say constituent and zip code that he or she will recognize, and then they'll bring it up. So that's a way that you can kind of help get through some of the clutter of how many emails we get, because we'll have private emails, work emails, and legislative emails. So that's one of the things that you can do. Also, we have legislative assistants who will try to connect meetings with us. So if you want to come to the Capitol, we have offices at the Capitol that we can meet that are all handicapped accessible, so that for people who need wheelchairs, accessibility, it's pretty easy to get around. The Capitol's under construction right now, so that's kind of off limits to all of us right now. But so it's fairly easy once to get to the building to get in and out for folks who need extra assistance or accessibility. So if your legislator doesn't get back to you, you might want to just send a reminder, just like I got today. Hey, I hadn't heard back from you. I sent you this thing. What's going on? Your legislator will get back to you. Your legislator will also meet with you. So if you want to meet your legislator at the Capitol or at your home, if you invite them to your place to say, this is what's going on, you want to come out, they will do that. And then I think you really have to understand how good of a lobbyist you are as a parent. You're the best lobbyist in the world because you have good experience at advocating for your child. That you probably, especially if you've had a long road of medical issues, dealing with insurance companies, dealing with hospitals, dealing with doctors, dealing with anesthetists, surgeons, on and on and on and on and on. You know how to work through the myriad of folks that you have to fight and fight and fight and fight and fight and fight and fight to get what you need for your kids, because you're going to do that. So parents tend to make the absolute best advocates at the Capitol just by nature of necessity. It's really been an eye-opener for us and the committee, I think many of the newer members in particular, to just see how complex the medical needs are that are being addressed at home. When we see the testimony and see the photographs of people, what you can be doing in your home, and you kind of say, wow, are you sure you should be doing that? But, you know, moms and dads are practical. And you're like, yeah, well, we just, you know, rigged up this machine over here. And it's like, oh, okay. And, you know, it's really a great thing because, as was brought up earlier, you've had your kids in the hospital and you've had your kids at home and you've seen the bills and you've seen the letter that says, don't pay this, but look at all this money and don't pay this. So you've seen the differences in the cost between treating folks at home versus treating in the hospital. So that's a really big deal and a very good story. But I can tell you that when we're discussing priorities and money, stories really do matter. So if you have a personal, compelling story that you can attach to your family and give that to your legislator, that will stay with them much more than something about, you know, we need more reimbursement for whatever acronym for whatever program you want to think of. If that's this family in my district that's going through this, that needs this right now, that's going to make an impact on that legislator. It also helps us to communicate, whether it's in the committee, on the House floor, when we do have to make budget decisions, we can use those stories to help change other people's minds about priorities. So they're very, very effective at doing that. One of the things that we're going to be looking at is we had a big nursing home bill that really changed the way that we reimburse for nursing homes in Minnesota. That cost a lot of money to get that in place. It's going to do a lot of really good things for nursing homes in terms of being able to have just higher hourly rates, but also medical care for insurance for the people who work there. So it made a big difference. We're looking at the need to extend that beyond skilled facilities and into the home for community-based services. So that's going to be the next big push. That's where you can really, you know, take your stories to the Capitol and really bring this to how are we going to take this next step to improve services at home so that we can have more nurses and providers in the homes and in the communities. We can train more, we can pay them better and get better benefits, because that's really the bottom line, is that it's going to take more money. So that story is going to be one that's going to be told, and that you can help tell that. But it's going to be, it doesn't happen, as Bill's saying, very quickly, but sometimes this is many, many sessions and a long road to hoe. But particularly if you've had a couple bumps along the road with yourself or your family or your kids, kind of used to dealing with the hassle and pushing ahead and solving problems and being very practical for advocating for your family. So we would welcome that. We encourage that. If your legislator doesn't get back to you right away, just let me know and I'll hit them with a tack hammer or something, because that is their #1 job, and we want to make sure that folks are getting the attention that they deserve, because it is your legislature, and it's we spend a lot of dollars in healthcare. We waste a lot of dollars, and it really breaks your heart when you see that, because there's people with many great needs in the state of Minnesota that are not being addressed. There's people who are availing themselves of things for which they are not entitled to, which doesn't work long term. So we have to make it fairer, and we have to make it better for the state of Minnesota. And really, I think it does begin with advocacy from good people like you. So thank you for being here today and for making the sacrifice and time for this evening to be here. And I would just encourage you to contact your legislators, and or me directly, and I can tell you who that person is. Be happy to do that. And also happy to answer any questions this evening, tonight, and beyond about how you can connect back with the legislature. So thank you very much.
Representative Dean, thank you for coming tonight, and thank you for that great presentation for our patient families. We have a few legislative advocacy veterans in the audience, but most of them have not had those kind of contacts. So for you to kind of lay out the path and to spend time with us tonight, we really, really appreciate it. So thank you for coming. Okay, so how can you help? In the packets that are on your tables in front of you, there's a little sheet that says how you can help. I'm not going to read through it right now. You can take that home with you. But the Minnesota legislative website is great, and it's really easy to use and figure out. If you go to our website and you can see the link, it's under number 2 there. You just put in, like Representative Dean said, you put in your address, 1212 Main Street, Minnesota town, zip code, boom, and up will pop your state representative and your state senator with all his or her contact information, email, phone number, and snail mail address. And as Representative Dean said, some of them communicate in different ways. What I've found as a lobbyist over the last few years is sometimes the old U.S. Postal Service, because I think that stack on legislators' desks gets smaller and smaller every year, while the email inbox gets bigger and bigger. But definitely, I am here to help. My contact information, anybody that wants it, it's on the website. My cell phone number is on my business card, is on the website for you. And I know that those that worked with us last session on advocacy, like Pat Lang here in the front row and Debbie Harris, and Becca Wergler never hesitated to text or call me at any time as we were going up to testify and meet with legislators. But what we're trying to do this year, Mark referenced at the beginning that we have kind of a late start to the legislature. Representative Dean mentioned, interestingly, as an architect, we're refurbishing our beautiful state capitol, which is completely closed to the public right now. So the session is starting very late for some construction purposes on March 8th. So we have several months for us to reach out to our local legislators and ask them to do a home visit. Stacy Vogley's here just 2-3 weeks ago. You had your state representative, Dan Schoen. Wasn't too difficult to get him in there? Yeah, I think you sent him an email and yep. And he spent, Cameo and I went along, and he spent 2 hours in her home. So, I mean, that's what we need to do to make the impact. As Representative Dean said, these personal stories, and nobody can tell it better than you, are what's going to make a difference in this effort to change some home healthcare nursing policy in the state. So, in the interest of time, I think we will move on. And of course, I'll be around after for individual questions and guidance. Oh, sure. I didn't know that was my job. Okay. So we have a quickish little video, and it just kind of shows a meeting in a legislator's office, which a few of you have done. Hopefully all of you will have done several times, both with your state representative and your state senator over the next several months, and to tell your story. And so here we pretended we were at the legislature, and don't laugh.
Oh, good afternoon.
Hi, DJ. Bill Amberg with Pediatric Home Service.
Pleasure to meet you.
Becca Wergler.
Pleasure to meet you. Can I help you?
Yep, we're here to see an appointment with Representative Govt right now.
I'm sorry she's not available at this time.
Okay.
But if you could just take a seat in the hallway, make yourself comfortable.
She's running a little behind.
It could be 2 minutes to 2 hours, so
okay,
I can't really promise anything, but make yourself comfortable.
Thanks.
Thank you. Hi, Representative Govt. I've got Bill Amberg and Becca Workler
Oh, yeah.
waiting.
Have them come in.
Okay, very good.
Hi.
See you again,
Hi, Bill.
Representative.
Hi, I'm Becca. Nice
Becca,
to meet
nice
you.
to meet you. Welcome.
Thank you.
So,
Thanks for meeting with us today.
this is my first year in the House of Representatives, and this is my first time on the Health and Human Service Committee, so I know very little. My background is in corporate finance, so please be as detailed as you can. But what brings you in today?
Well, legislation, oddly enough. This is House File 1122, and you don't need to read it right now, but it's there for your reference. And we're talking about the crisis in home care nursing. We have a crisis in nursing, not enough nurses in Minnesota at all levels, but when it's at the home care level, it's even beyond critical. And Becca has home care nursing for her daughter, who has some complex medical needs in the home. But I'll let Becca tell you a story about her and her family and her daughter Claire.
Yeah, so I have two daughters, 8 and 4, and I'm here because of Claire, who's 4. She was born with spina bifida, had some complications with that required her to have a tracheostomy tube as her airway. Because of that, she also has, her vocal cords are paralyzed, as well as central apnea. So her head doesn't talk to her chest to, breathe like you and I would. So she has to be on a ventilator at night. So Claire in 4 years has had 10 surgeries. She's a little tough cookie. And I have some pictures of her so you can see. And she's 4 again, or as of today, she's 4, and she is absolutely thriving at home. But I can say I can contribute that to our nurses at our house. So she gets 20 hours of care every day. And that nurse is, my husband and I both work full-time. Well, my husband, I shouldn't say we both anymore. My husband works full-time, and I am a full-time student. So when I'm at class or my husband's at work, we need someone to take care of our child, because as you can see, she can't just go to any daycare like other kids. And so she's at home with a nurse, and that nurse is the respiratory therapist, is the nurse, is the doctor, is the person that sits on the floor and plays with her, is the one that tends to all her needs. What the most important part of that nurse is that they can respond in emergencies. Now, in a hospital, when there's an emergency, they have a whole team of people that come running the second something happens. At home, you have one person, and maybe the parents if they're there, and then it's 911 and you have to wait.
Right.
So that nurse has to be trained well to respond in those emergencies, because it's life or death for my daughter. And I have to have enough trust in that nurse to be left, my daughter, to leave her alone with my daughter. Something for that we've seen, we've been doing this for four years.
Okay.
It's not new to us. We've seen a lot of turnover with nurses. It's not because they don't like what they do. It's because they can go to a hospital where there's more pay, there's a little bit probably more diversity. Benefits are huge.
Yeah.
And we've never heard a nurse say, we don't like what we do. I mean, they love what they do being at home. It's a 1-to-1 patient, nurse ratio, which you don't get that ever.
Yeah, that's true.
And on our side of it, trying to provide home care nursing for families like Becca's and patients like Claire, it's a constant struggle for us to recruit nurses, train them, because as Becca points out, they don't have the backup team that you have in a hospital. They need to be good at what they do. And different kids in different homes have different medical conditions, so we train them generally and to specific patients.
Okay.
So once you get through that training, typically kind of younger students, not always, these are who we're able to recruit, and when things open up in a hospital, $10 an hour is a lot of money. And right now, we're not the only ones. Any home care agency, home care nursing in Minnesota right now is in this constant battle. Get nurses in, train them, losing nurses. And what often happens increasingly in the last several years,
parents are having a really difficult time because we lost a nurse. I can't go to work. I'm the only person that knows how to run the equipment and this kind of thing. Her condition, a lot of kids, unlike Claire at this point, can communicate very well. She's a very bright girl. A lot of kids can't communicate. I mean, that's what pediatrics is different than adult medicine. We go in to see the doctor. Doc, it hurts when I do this, is a big part of what medical professionals learn for a diagnosis. With kids, she's not reacting the way she usually is. There's something wrong here. That tell and knowing the patient can be life-saving. So we're just in a constant battle, and honestly, Representative, we don't know how much longer we can provide this service because the medical assistance, the MA reimbursement rate, is so much lower than what the hospitals and institutional nursing settings are able to provide for their nurses, and it's tough.
So can you tell me what it means to your family when a nurse doesn't fill a shift?
Chaos. Well, I mean, realistically, it's the initial shock.
You guys, I think we get the gist. I think this is essentially just giving you guys a little bit of an insight on how to work with your legislators and representatives.
And it occurs to me that perhaps there's a big missing piece that we may not have mentioned to y'all, which is what the heck is the bill we're talking about? Let me tell you a little bit about the bill that we put forward last year. If by way of explanation, the state of Minnesota reimburses nurses on two levels, a regular level and a complex level. I'm going to tell you that the complex level is most of your kids, okay? A regular level is a much lower case dollar amount. What we did was go in originally and say, let's make it 3 levels. I gotta tell you, we dropped that. I'm gonna tell you why we dropped it. It was because it was really hard to define the 3rd level and keep it broad enough so that we weren't visiting it every 3 years, because as medicine expands, what might fit into the 3rd level becomes larger, and we didn't want to expand those. So what we basically did is we're going to go with 2 levels, and we said for the complex level, we want a 25% increase in reimbursement, 25%, okay? What that amounts to is $10 an hour. Now, what we also did, so we can reassure you of what that dollar amount means, is we did something called we encumbered it. And what that means is that money that we are asking for from the legislature never, ever, ever gets to my pocket, okay? It is encumbered by saying it all goes to the nurse. And it goes in 1 of 2 ways. It goes in 1 of 2 ways. 1, direct pay, and 2, training. Now, I had made it so that a portion of it was training. One of the senators, Michelle Benson, said to us, don't do that. Because you've got a law now that says you have to pay this amount of money every year for training. And when you have a cache of nurses that don't need the training, now instead of being able to pay them more, you got to pay it into training. And so don't do that. So the encumberment is a little different than what originally. So our bill right now is to increase the dollar amount for those complex patients. We are not giving that one up, even though that only addresses right now the reimbursement for RNs. And we don't have a lot of RNs, and we don't have a lot of home care nurses available, but nonetheless, the ones we've got, we got to keep. And remember the 3 things I said? Well, I can't give them a colleague, and I can't always make the home environment where they want to be, but I can give them more money. And so that's what we went after. So when you are looking at the bill that we are trying to push through the legislature right now, it's a bill to increase reimbursement that will then go directly to the nurse that takes care of your child. For those of you who have private insurance, you say, so what? I got private insurance, how that helped me? I will tell you, believe me, how the state goes, go private insurance. And if they think they can reduce and ratchet down the reimbursement, they'll reduce and ratchet down the reimbursement. So if the state makes a commitment that there is more dollars available to take care of patients, then the private insurance have far less ability to say it than we're much. The other thing that I think is extremely important for us to recognize in this whole situation is that private insurances have a very interesting way of telling us it's not covered item. And one of the things that I would encourage you all to do that have private insurance is to remind them that perhaps it should be. You pay every single solitary month a premium. That premium should be worth something. And oftentimes you will look in your pamphlet and say, hey, it says home care benefits are covered. Well, you might want to remind them this is a home care benefit, and all they get out of it is they it's only limited to 20 visits. No. Keep going after them, you guys. That's who we need to get, because the taxpayer can only pay so much of this. Your health care insurance benefit should be used to take care of your kids. And it shouldn't fall exclusively on the state of Minnesota. And the state of Minnesota should not be the last answer. And we have in health insurance, sister will tell us, oh yeah, well see, if this is what the state says. We don't have to pay that because the state will take care of it. That's their job too. So you got two prongs of attack here. Your health care insurer, and believe me, you keep nagging at them and something's going to give. Maybe not for everybody, but it's going to give for you. And going through to the state of Minnesota and letting them know that even though this isn't a panacea, these nurses deserve more pay than they're getting right now. And even though it's a 25% increase, that in and of itself is only $10 an hour more. And you guys, that doesn't even begin to touch the salaries that we got for people. So those are the things that we are looking for you to do. And so, Bill, what's the number of that House bill I forget? 1122? So when you talk to your representative, 1122 is the bill you want to talk to. And I want you to know we have a legislature that is made up of citizens, and they do care. And as long as you keep telling them what your story is, they will begin to understand. We're a problem company, a group. We have very small amounts that cost way less of money. And so it's not like the Alzheimer's groups that got thousands and thousands and thousands and thousands of patients that they can see every day. Kind of little numbers, but large dollars. So we got to scream loud and we got to bang that drum until we get what we need.
Right. I want to open it up for you guys to ask questions and any thoughts or any concerns or Beth.
I have two sons. They're 22 and 21 this month. They were supposed to live past a year. They go to college. They have trachs, ventilators, feeding tubes, they're in wheelchairs. And I have fought insurance companies and won 3 times. I've had a caregiver who starved my son nearly to death before I figured out what was going on because he was very ill and he had a surgery that went badly. And I testified in front of the House, and there wasn't a dry eye when they saw the pictures and what we went through. And what I was testifying about was the law for starving a child, maximum sentence was a year. So are you kidding me? How do you stop people from doing these things? You know, I don't want to incarcerate people. I want to stop them from doing it. You have to have this incentive. And they made me part of a committee. We got the law changed, and it actually was pretty quick. So don't give up, I guess, is my message. But it takes more than one person to do it all. We all have to do it, but we can change it if we don't give up.
I think that's a great point. We have to keep, it's the old adage, the squeaky wheel gets the grease. And we have to be the squeaky wheel. Not if it's not for your kids, it's for the future kids that are sitting in the hospital that want to be able to get out as well. So.
Representative Dean helped us with the issues that we had last year regarding medical equipment and medical supplies. Because of Representative Dean, we were able to accomplish something that allowed companies that provide equipment and supplies to be able to continue to give that access to the entire state. We have groups of people that will listen to us. And Deb Harris and Pat Lane and Becca and Chad Workwood, and Dan and Suzanne Holmes came together and spoke to these guys. And they made a compelling argument. And so I want you to know, you really are our great festival.
Mm-hmm. I'll tell you, if there's any families out there that would like us to be there with your representative, if you can get them at your home, let us know. I can come out, Susan can come out, Bill can come out. I mean, we'll do everything in our power to make us available for you guys to be able to help walk through those steps. And Stacy.
Hi, I'm a parent of a 14-year-old at complex like everybody else's kids. I'm also a consumer support planner in the waivers. And what I personally am doing right now, because we lost two ambulance nurses after 5 years who both made different career choices, mostly regarding they weren't getting good enough healthcare benefits from their agency, which isn't a new story. But now I'm like everyone else, searching, trying to find staff and trying to be creative under the waivers. I've had advice from our county, go become your own PDN agency. Yeah, right, like I got a couple grand later on, but yeah, and time. But what I'm doing is paying the nurse $10 an hour, actually 11, more on the side than we're paying for complex care to our home care agency under our waiver. So I'm doing what you're saying about the more money. Money helps. It doesn't always be in your answer, but it does help. Here's my point to you. As a support planner, I mainly work with kiddos who are also complex like mine because I get it. I get the nursing piece for families. Not all counties will let you be as creative. Even though the CDCS program is supposed to be federal dollars to the state, you know as well as I do, 87 counties are doing it 87 ways, and getting a clear answer out of DHS is sometimes rather challenging. Because I just tried to get this issue cleared up for a client of mine in Anoka County, and Anoka won't let me do this similar thing for another family. So I don't know if you have any way to help. When we are trying to be creative with what little we got, out here to make the best of the situation, which is still challenging, but 2 cents there that we need to tweak some of our CDCS waiver rules too. It hurts when I go out with a great idea and I can't get it through their county form. Okay. On that note, I was having the same challenges. So trying to independently contract nurses. My county came back to me and said, well, they need to have Class A with the license, right? So I told them how expensive that is for Cook County. So anyways, talking about clear solutions, I've had a conversation that this is prohibitive for me to be a person in my home, and now the state has said you need to have this. So basically, my county worker said, we're going to have to take a look at this because if your agency can't staff you, I mean, you still have to be responsible for staffing this, and DHS does their best. But, that's what we have to do sometimes. If you just want a nurse for 1 or 2 hours, you need a staff nurse through an agency for 4 hours at least, because they're trying to make a living too. But that Class A home care license has been prohibited when you're trying to get contracting situation. Well, then I got to order to agree that independent contractors, but then the school district wouldn't let that nurse in. Right. So there's a lot of, even when we're trying to be creative. So it's on the both sides. I think that they're not acknowledging it, and they're putting some of those independent contractors through the CDCS, but it depends on who's reviewing your plan and who's signing off on it, because waiver reform is a big topic. I mean, and you've heard about it in the papers now, the Olmstead plan where, they're supposed to be using that money and some are already getting, some aren't. I think there's a whole bunch of reform, but I think letting our representatives know that the lack of consistency has provided a big problem. That's really, and quite frankly, I got to
tell you, I didn't know you had to have a Class A license if you were a family, because we have families that do
I've been
this.
staffing nurses for a year, and then I went through a series of county workers, and the last county worker came back and said, well, I don't think you're in compliance. And I was like,
And it changes from county to county.
Yeah.
This is the scariest thing, because we're talking about the lives of children and young adults. It's not like we're talking about an inanimate object. And there is, if you're alive, this is the scariest thing. It's a very scary thing.
Well, you're not actually asking for more money under our waiver. We're actually just asking, let us be creative. But you're asking for let me control how I use it.
yeah.
And if you can buy a ramp, why can't you pay the nurse? And because the nurse is still licensed.
Well, and when you do that in kind of contracting, you have that leeway to creatively move around it. You know, you can't provide the benefits for the nurse, but if you happen to find an individual that has a spouse that can provide that or whatever, you can make up the cost of it. But at the end of the day, this is one thing I think that's really important. How you treat the staff that comes in your home. I mean, I treat my nurses like they are the sun and the moon and the sky. You know, providing a good work environment for these individuals is so important, and that loyalty takes you a long way. You know, being flexible, you know, caring about them, and you've got to have boundaries, but at the same time, you know, when you talk about whether they're a 2-year or even a 4-year, those nurses have gone through a lot of student debt to come into your home, and they deserve to be treated more than just a servant. You know, appreciate that. Yeah, it's just.
I think it's a great point, Diana, and I know that I've met with families, and I know some of our other leadership have met with families. It's what I like to say, it's a nurse's world, and we're just living in it, because it is all about because as Susan mentioned, the 3 things, and one is the environment. And that's something that we can't control. We can't control the environment that the families or that the nurses go into. And so I think it's something it's challenging for myself. I know for other folks here at PHS to say, you should do this and you should do that, because you guys are our clients and our customers. We're not used to saying this is what you guys need to do in order to help PHS. But I think it's a very valid point that you have to make it a warm and welcoming environment for the nurses to go to. If it's not, they've got so many different options available to them that they'll go, I'm done. I don't want to do this. I'll go work in the hospital, work in a clinic, work in a skilled nursing facility, something like that. It's just that there are so many options. And yeah, home care is one of those lowest paid options, unfortunately, because that's where we know everything's going. The care at home.
I think to Becca's point that she mentioned in the video, these home care nurses oftentimes are looked upon as lesser nurses. And not all the time, which is really insulting. And when you look at it, you know, I always keep saying to people, you know, when you're in the hospital, and I was in the hospital for years, when you turned around and you hit the button, everybody came. The cavalry was there. In the home, my God, you needed him. And that nurse has to make split-second decisions. And I say to all of you, and to the nurses that work here, you're the best. You are better than anybody else, because Dr. Maynard will tell you when they're in the intensive care unit and there's a problem, there's a whole bunch of doctors that come flying in. And now the nurse is just the adjunct. In this particular case, they're the big guys. And so to Diana's point, when we think about those nurses and all of the things that they're trying to manage and skill, to make them feel warm and welcome is absolutely something that goes in their colorful way. That is not to say that they don't have to respect your boundaries and your family rules, et cetera, because we know that's part of the way they belong in your world. But we do appreciate that. I think.
Burn. Bernadette has a question.
I'm just worried about the fact, you guys, that we don't have enough nurses. I mean, and when Bernadette says it's scary, I mean, we don't have enough nurses.
Yeah.
And I think it's going to.
Go ahead.
I was just going to, I have to temper myself because it's a very, very emotional issue. Those of us that have older kids, and I've been in this for a long time. My kid's 28. I've been doing this a long time. I've seen this nurse shortage wax and wane, and this is another one that's coming, and maybe we survive them. And it's just a very, very difficult situation. And I'd love to be a mentor to people who are just getting on this bandwagon for the first time. But there's so much, and I hear Pat's story and Jeff's story, because this before, it's so much education is needed to the community at large and to providers and to the legislation people who don't understand what home care nursing is for our diverse population. They're thinking that it is probably the visit world, you know, go in the home, make a visit, change someone's dressing. And it's the Medicare world. And it's not what happens to our children for continuous care, extended hour of nursing, and the level of care that our children receive. And so there's so much education that needs to be given to the legislator piece, but also to providers. And Pat mentioned this, and Deb and I know what parents as teachers are, and we have done this for decades. And those programs that were through the U of M and through PACER that we all participated in, and we brought residents and interns into our home, and they're blown away by what we do. And when a doctor, a current doctor or a current provider, now I guess is the term you have to use, writes the order, discharge home, they have no idea what that means. Not a single thing. They just write an order to discharge home. And then, like, all of a sudden, that just magically happens. They have no idea what that means. So part of our job is we have to educate so many people what that means. And that is an exhausting thing. And we do it day in, day out, day in, day out. And that also happens when we lose our nurses. And we have to entertain a new nurse, and a new nurse, and a new nurse. And that gets tiring. And the longer we do it, the harder. But we have to, because we want our children at home, and we have to have our children at home. That's what we want. And so we have to do a balancing act. And we want these nurses who are stellar, and we need them. And I praise them because it is. I happen to be a nurse myself. I was a nurse before I was a mother of this kid, but I always worked in the hospital, and I always had the Calvary. And I didn't realize what these nurses do. And they're spectacular, and I praise them for what they do. The community at large does not know what they do. And we have to teach them. Because if we don't tell them, we can't besmirch them and say, you don't know. So that is our job. We do have to go and tell them, and we do have to share our life stories with them. And the only way we're going to do that is to invite our legislators into our home, or go in the office and tell them, and bring our children with them, our beautiful, beautiful children, and say, this is what we do. And they will be shocked, and they will help us. But it is very long and slow and baby steps. Nothing happens quickly at the Capitol. But their hearts are open, and they are human beings, and I'll tell you, we are a very low incidence group, thank God, but we do take a lot of money, and there isn't a lot of money to be
Right.
Do you guys, is it all right to bring up the question, what's the fiscal load on your 25%?
Yeah, well, I'm not gonna be horribly popular in the crowd. I'll tell you what it is. I'm not gonna be horribly popular because we did something, we call it a pediatric bill.
Okay.
And unfortunately Bernadette's and Deb's kids are older than that, so, and we were challenged.
They do grow up though.
That's right.
Yeah.
Yes, for the first biennium, it was about 7, almost 8 million, and in the second one, it was about 12. However, it was only for people under the age of 21. And we did a little, in our brainstorming this week, we did a little look-see. If we brought the adults in, believe it or not, and I was shocked at this, there are substantially more adults, people over the age of 21, 3 times as many people over the age of 21 that utilize complex home care services through the state of Minnesota. 3 times. So when you take 3 times 12, I will tell you now we're talking, just a tick below 40 million.
When the rep was in my house and I said all 3 tiers have to go up, but I don't think I said a percentage, I just said up.
Yeah.
It's a lot of money.
And he threw out 100 mil, and I'm just gonna say, that sounds not awful.
It does.
But our school district just passed a $95 million bonding thing, and I'm like, come on, this is for kids whose lives depend on nursing, equipment.
But I will tell you, that school district has how many students?
4,000.
And we have 450 school patients. So when you look at 100 million and 450 or 4,000.
Well, 100 mil is all those 21 plusers though.
Right. Well, and the question that the legislature posed to us when we testified is tell me what magically happened at age 21 that they don't need this higher level here. And the answer was, I'm a pediatric company, and so that's what I was talking about. It's a lot of money. And when Representative Dean has to come up with a lot of money, he has to figure out, because we got 100 bills that we compete with every single summer care session.
Is there any way we can squeak anything more out of the feds on that?
What?
Can we squeak any more out of the feds? Is there anything we're missing on this? I bet there is, right, on the home page, on the home care stuff? I know we're jumping through most of the hoops.
Yeah, it's pretty tough.
You know what we got to do? Because, you guys, we don't have any nurses. I mean, I know you say wax is the wings, trust me, I don't think this one's going away.
No, it's not.
We got to look at a different model, and we got to look at a way that we can do other things. And in the process, look at a way we can continue to figure out a cost-effective way of providing this care in the home. It's going to be radically different than what we see today. I know that. I've got all kinds of ideas, and if anybody wants to listen to me wax on, I'm happy to tell you, but nonetheless, we have to figure out something different. And in doing so, maybe we can drop that cost, and maybe we can use other resources that we haven't used in the past. I don't know exactly what that's going to look like. The only thing I guarantee you, it isn't going to look like what you know today.
Yeah. Oh.
You know, what I was thinking about, just give an example about dollars and cents. It's, I don't maybe look at dollars and cents as what's in front of a person. Because if we thought about the road we drive on every day or the bridge we cross, how cruddy it is, and you throw hundreds of millions of dollars into a road system and all that stuff, it's because it's in front of us every day. And that's the big point, kind of over top about it. We got to get these roads, our kids, these, physical things. It costs a lot of money. People don't see them every day. They don't think tangibly about these things. So we have to put them out there. Promote it, do all that stuff, because that is how we get the road fixed.
I think it's a great point. I know in some of my family visits talking about, and I'm glad Representative Dean said, invite us to your house. I think if you want to really get their eyes open, invite them to your home, see all the equipment and everything that's going on and that sort of thing. I think that is really the big kind of alarm bells that go, whoa, this is like a little ICU in the home. And so they see that and they just explain your story, tell your story, what happens when you don't have a nurse and what that does to the entire family unit, the jobs, the schools, your other kids, and that sort of thing. I think it's those stories you need to be able to tell.
It's so huge. I had somebody in my home a couple weeks ago when I didn't have a nurse representative. It was kind of funny actually, because I had no nurse, so I feel sorry. It was all fun and games for her. But, so I'm trying to get the point across about the nursing shortage, but I had to suction, I had to do this, I had to do that. You know, I'm going back and forth. So it was a beautiful thing. So at the beginning, I was like, oh, I don't have a nurse. I can't go get milk. I can't go get my prescriptions. I work full time. I can't do this. As so many other people have the same issue, right? But this guy's sitting there, and I turned one time and was watching, and he said to me, he had no idea. And then the coolest thing he said was, he's coming again tomorrow night, but he said to me, can when we got done, he said, it's not me, it's somebody, I don't know, I'll tell you. But he said, can I bring my daughter over? I go, what? And I go, is she a nurse now? And he said, no, but she thinks she has life tough, and I would like you to do that. I would like you to kind of mentor her. But the point that you made is a beautiful thing about educating, and that's what people can't step into any of our frame of reference. They don't get it. So whether it's the guy that's a security guard at Children's Hospital, or it's a little kid when we're in a mall or we go someplace, yeah, right? And little kids are looking at her like she's a freak. I go, come over. A grandfather the other day said, don't talk to her. And I go, Grandpa, please, can you come over? Can you just let him see? And this little boy wants to know. Right. So it's our job to educate everybody, not just political people. It's the doctors. It's Dr. Anderson.
He's over.
Go in the corner. All right. So I know that you know this guy. I think it's John Stam. Yeah.
Oh, yeah.
Okay. So the coolest story, right? We go to the state fair against everybody's wishes, right? But we go to the state fair because we want to see Garrison Keeler. Sorry, I'm old and he's old, so we want to go. So we go, and we're sitting in the front because one of her buddies plays with him. And John, I don't know if you heard the story, but John was sitting behind us. I don't know him, and he is what? The director of your manager. Yeah, so he's behind us with his wife. Garrison, I have no idea why, because I never met him, comes up out of the crowd, comes over to her, and starts singing a song and holding her hand. There's 6,500 people, and there was not a dry eye anywhere. Garrison was blown away. John and his wife were behind there. I never met him, like I said. He is sobbing, and he's taking a video of the whole thing. But I'll say it. So somebody was watching our video of Garrison that she taped and it was a nurse in a hospital, and John walked up and said, oh my God, are they patients of ours? Holy cow, he didn't even know. And he said it was the most beautiful experience of my life that I got to see. He goes, that nurse was there giving meds through the tube. That nurse was doing this. They had a wagon full of supplies. That's how we roll. Yeah, that's how we roll. And he said this, and our sweet, great nurse, Bonnie, he said to her, those people probably don't go out very much, do they? And Bonnie goes, you don't know them. So we went into the clinic for an appointment, and she told me all of this. So we went in for an appointment, and I said, could we meet this guy? Good job. So we did, and we have now invited he and his wife, and some of the older guys there, sorry, but the guys my age, over to our house. So if he didn't know what we live with, all the stuff that all the time we spend with him, if he didn't know how many people in your lives don't have a clue. It's not about poor pitiful me, right? It's about what we need as a team to do to help each other.
And I think one of the things that Pat points out is, and again, probably politically somewhat incorrect, but it takes a village. And so it's not just a nurse. It's not just a physician. It's a community that perhaps we can engage them in helping you. It's a church group that needs something. Maybe we can help them help you when you don't have a nurse. What else is out there for us to take advantage of so that, in fact, you get the help you need, the rest you must have, and your child has the safety of what they need? And so when I'm talking about a new model, folks, we're looking at everything. We're turning over every rock we can see to provide something that may be different than what we have today, but that provides you what's in it for you, and this is what we're thinking that is in it for you. Deb?
Well, I guess we came along kind of, those of us who have 20-year-olds, my son is 22 now, so we kind of came along in the golden era.
Yes,
when our son was discharged from the hospital. They had a transitional care unit. Younger parents will probably know about this, but the nursing agencies came to the hospital and trained the nurses at the hospital before we went home. And so that kind of 20-year span, I think, was probably the bright spot in all of this. My husband always says that I go to the deep end about everything because I'm kind of an alarmist, but so when we pack, and I tell the nurses, just pack as though the apocalypse. So we have to think on it. We're off the grid, there's no electricity. Probably the older moms, I'll have a delete in our purse. And so we got kind of spoiled from that, and our best night nurse just retired last year, and she was 80 years old. And she had been with us for 15 years, so she retired after she had already retired from children. So when she announced her retirement, I said, do you have to just think of yourself? We had another nurse, a day nurse for 18 years, and I just don't know if that's going to happen again. So I said all that to say, what kind of model do you have in your imagination? Like, what does the future look like for us?
Robots. You know, I don't know. I mean, I don't know. The no is it's not going to look like what it is today. I think there are some things that we may be interested in doing. We just began talking about it. So before I say anything, I'd like to kind of, first of all, figure out what it is we want to talk about. And then, of course, we've got to vet it with our providers. I mean, if the physicians aren't on board, none of this happens. And then we got to vet it with you guys. We got to say, please do this. I think there are times when we have people who have needs that might be better served or as served as well by people that don't have an RN.
Okay, for instance, like our daughter, she's 27. She's PCA for us since she was 15. Our one son is now 18, and we have 4 kids that are home. Our son that just turned 18, she has worked with him since he was 6 years. Now this last winter, 2 of our sons, the other son, she also works with, is 14. We've had him for 4 years. And this last winter, both of them got trachs. One is a separation, one's a regular trach. 2 in a winter is really tired and not but anyway, we've kept her at the PCA, and she's taken all the trach training, and she's done everything. Twice she has saved our one son's life because she knew him so well. The nurses were brand new. They didn't know that he looked in a bad way. And I don't ever want to let her go, but she's a PCA, you know, for her to get her nursing time. Is that something you're looking at? People like that, getting some kind of other training where they can.
Again, I want to be clear. what I think, or what I dream about probably has all kinds of things that, I have empathy for what you all do. I don't know what. I'd love to say I get it. I would be frustrated. I empathize with what you're doing. I have ideas on things that might work. We have technology today that we didn't have 25 years ago. We have things that maybe we can utilize to help offset some of the worries. Do I think PCAs have some value? I think that you did know. Where they belong in the spectrum, I don't know. But I do know that what we have to do is look at something different. And then we have to talk to our legislators and say, we have an idea. Can you think about it? And in doing so, what's the cost associated with it? And how can we make that a priority? I guarantee you, when I sit waiting to testify, there isn't anybody that comes up and testifies that I go, oh boy, they need that. Somebody better get that for me. Because we're talking about all kinds of issues. The only one that really bothered me, hopefully, not bothered, was hard for me to understand was the tax issue on propane tanks. Never really got that far. But other than that, it was really, there is nothing that comes to the Health and Human Services Committee that isn't valuable and worthwhile and needs funding. So when you look at the fact that Representative Dean has X amount of dollars and he's got 100 of us with different causes begging him for money, it's hard for them to figure out where to spend that. What we have to do as an organization is we have to come to them with something that's creative, that's different, that they can understand, and they can see us giving as much as they're we're asking them to give. And if we can do that, then I think we've got a fighting chance. But we have to look at what is it today that we're facing. And Deb and Bernadette and Beth, you guys were in the Gulf War, where there were nurses that actually thought this was cool, where there were a whole heck of a lot more nurses than there are today, and who, quite frankly, were taking care of really challenging patients. And now, what we have...
And they loved what they did, and they were committed to it.
And they were committed. Now what we've got is an ever-shrinking group of people that we got to use them where we need them. And I don't know how that's actually going to look when all is said and done, but I think it's going to be something that's going to have to be very creative, and y'all are going to have to help us.
Go to the legislature with not how much it costs, how much cost we're taking out.
Yeah.
I
show that.
I think they get that. I think they get that, but it's a challenge for them to be able to put dollars and cents to it. And again, I want you to understand, who was it? Pat, I think it was you that just said, it's not just them. You know what? Your neighbors don't know about it too. Because when everybody, how many people here that Health and Human Services suck up all the budget and who are these scofflaws that are using Health and Human Services dollars? Well, hell, it ain't scofflaws enough. But the reality is our neighbors don't always understand that. And so part of our job is to not only educate our legislators, but the people who are around us. This is money well spent, and in fact, folks, it's a cost savings. But they don't see that.
I just want to leave Representative Dean with this idea that, again, it comes back to the goal of the group is to spread those dollars and make them as most effective as possible. The return is so clear and obvious to me that the fact that we wouldn't want to find creative big ideas to achieve better outcomes with less money seems just incredible. Like, why would we not? Why can't we figure that out? Why wouldn't we create policies that are going to encourage this rather than not? When the return on the investment, both from the quality of care and also from the cost, is so obvious, I would take that back to the group and say, you know, this is something we have to do if we want to serve more people. If we want to spread our healthcare dollars better and be able to help more people, this is the direction we have to go. We don't have an alternative. Putting them in the hospital takes, my daughter will pay for this medical, for my nurse in 2 visits. And she'll go there. So you can either choose to do something about that and helping that nurse that lives in my house so she doesn't go there, or she's going there. And now you got less money to spend for all the other people who are reaching out to you saying, I need help, I need this. We want to be able to help our kids, and we want them to be in our homes. And it's going to be better for you and the rest of the legislature for that to happen. So don't discourage anything that would encourage us to be creative about how we're going to do that, or for God's sake, close the minor gaps that exist between, a nurse's pay and a home health care's pay, because I'll give you that investment back by like March.
That's right.
Representative
too. Oh, go ahead, I'm sorry.
Just real quickly, Representative Dean also pointed out is what should happen and what makes sense. They don't allocate people, so there's that gap that we're working against that. I think that the numbers should speak, but they don't. So, and then, to address Susan when she was talking about a model that's going to look different. I mean, if there's no nurses, it doesn't matter how much we're going to pay them. It doesn't matter if there's no nurses.
Mm-hmm.
So where does the action of the legislation need to come to say, you know what, we need to look at tuition reimbursement incentives, we'll put you through school, but you got to work so many years.
And Diana, we're looking at that. The problem, I gotta tell you, is there isn't anybody teaching. The educators are also going to work in the hospital. You guys, the reason we're going after more money for the nurses we still have, is to keep the nurses we still have. There's time difference in the way we have that. But I'm not sure it's going to work, in which case the fiscal note will be a lot less. That's all I can say.
But I think it's a good point. Tuition reimbursement, they talk about right now you have a certain population that tends to go into nursing. Maybe if it was more affordable, you would have other demographics going into nursing, and some of those demographics are growing at a faster rate than your average white females are growing.
Right,
so I think that's a really good point. Yeah.
Well, and the other question is, have there been conversations about bridges in institutions? Bridges between institutions, because if hospitals are trying to discharge their patients and they can't because they're hiring their nurses, you want to control the quality of the nurse. And if you let's say you do contracts or whatever, like bring those nurses in, train them in the hospital, have that fluid situation between the hospital and the home. And it's very cloudy and very gray, but that may have to happen in order to get these individuals home. But, hospitals don't feel like they have the incentive also to do a contract with anybody.
I think hospitals are in the same position we are, which is they don't have enough nurses.
Right.
Well, so what we've got is this very small cache of people that have any place they want to go, they can go, and they command a beautiful dollar amount. And you want to know something? They deserve that beautiful dollar amount. I'm not arguing that. It's just that what that does is leave us in a lurch. We have nurses who will come to us as brand new grads and tell us that the hospital is saying, we won't hire you as a brand new grad. Go work at PHS, get trained, and come on back in 6 months, and we got you.
Well, there is another piece too, is that I know like children's, they're all union nurses. And that's a challenge that we're not union.
And if we are union, believe me, we couldn't take an MA patient if there was one because they get paid more than the state.
I just want to real quick, it is a little after 8. If you guys, anybody, we'll stay as long as you want, but I don't want you to feel obligated if you need to get out of here. You got kids and that sort of thing. So feel free to just take off, but we'll be here to answer any more questions that you guys have.
And Representative Dean was only here until 8, so I also want to let him be able to go.
and just to kind of close, I would just continue to advocate. You know, you're the best advocate for your child. No one can do it better than you can. And really, we talk about dollars and cents and priorities, and it's a big deal. But when you're looking at a budget of $12 billion, just within one budget, that's a big amount of money where we're having lots of dollars going in many different directions. The priorities of the state of Minnesota are to build a $1 billion Viking stadium. $1 billion, okay? For an owner that has several $billion of his own money, none of which he's using to build that building for athletes that make millions and millions of dollars. So that obviously wasn't an economic decision. It was one that was made on, we like budgets. So people care why you do stuff. So make sure that as you continue to tell your story, rather than to focus on what you do, focus on why you want them to do that. You know, and you know, we're a state with a big heart. We do miracles here. We do healthcare really well. You know, Lake Harrison Keeler, or the women are strong, the men are good looking, all the children are above average. We actually know how to do healthcare. Okay, we're a little self-righteous. We're actually really good at this. Okay, so we can do that. But really, I mean, and Minnesota's always been judged by how we take care of people in the dawn, the twilight, and the shadows of their life. And we're a big-hearted people. So that's why we do stuff. I would focus on that. And really the dollars should take care of themselves. So to continue to advocate for your kids and your families, and please reach out to me and everyone else in the legislature. Happy to help. Thanks so much.
Thank you.